Hi everyone, I'm back after several years. It's been a good several years. I had a lot of big changes, good changes in my life. I remarried in 2018 and became a mom to three stepsons, three amazing boys. So we are blending a family of 6 kids. And as you can imagine, or if you have experience with that, it takes a lot of work and effort. So my time has been on my family and taking care of myself and making sure that I can stay cancer-free, which I have. It's been 5 years since my diagnosis. I think I was diagnosed in March of 2017. So coming up on my 5-year mark, and I've been able to stay cancer-free. No evidence of disease at this point, so yay. I have done a couple things to stay cancer-free as part of treatment that was recommended by my physicians, and I'll go into those hopefully in future videos. Hopefully I'll have a few more videos to update you about my breast cancer journey. But for today, I wanted to talk just a little bit about my decision to get more breast reconstruction surgery. I've had implants in for about 4.5 years now, and they aren't serving my body anymore. So I will get a little bit more into my decision to explant them and take them out in a future video as well. But in preparation for the new breast cancer reconstructive surgery that I'm going to have, I had to have a CT scan. So I'm going to talk a little bit about that today. And spoiler alert, the surgery I've decided to do is called Diep Flap reconstruction, and it's pronounced like deep, you dive deep into a pool, but deep stands for D is deep, I is inferior, E is epigastric, and P is perforators. And those are the vessels that are found down in your abdomen. And essentially what the Diep Flap reconstruction is where they take those vessels, and they also take the fat and the skin, the tissue, and then they bring it up from your abdomen up here, and they reattach those vessels, and they make reconstructed breast out of your own tissue. From all the results that I've seen online and all the research I've been doing, I'm really excited about it. It is a huge surgery. It is a big recovery though. So, there are some pros and cons, as there is with everything. I had to kind of weigh whether I wanted to be flat or take on this big surgery, and I'll talk a little bit more about that in another video, like I said. But today I'm going to talk about a CT scan that I had to have prior to getting this surgery, and it was called a CTA, and it was essentially just a CT scan to check on my arteries and blood vessels in my abdomen and into my thighs. And it was actually ended up being a really quick scan. I was there for about 20 minutes total from the time I got taken back to the time I left. And I went back, they asked me to empty my bladder. I couldn't have anything to eat 2 hours prior to the exam because they wanted an empty stomach to use as a landmark for lining me up in the CT. And I was told to drink water, or liquids though, those were okay. And that was because I was going to get an IV for the contrast, so that it would be easier to put the IV in. So I went to the bathroom, emptied my bladder when I got there, and then was taken back. I pulled down my leggings only because they were compression leggings and they didn't want anything pressing on the vessels and the contrast as it went in. So I just had to lower those down under a blanket. She then poked around to get an IV in. They use a little bit bigger of a needle because they use more contrast quicker for this scan. It's a really quick scan. So the contrast goes in a lot faster and a lot more at once than a normal scan. And so we got that in there, and then she left the room. She did one scan to kind of get me like pre-contrast all lined up. She came back in and she started the pump machine for the contrast. She made sure that I wasn't having any reactions. I got a really warm sensation that moved from like the top of my head down my chest into my abdomen and bladder area and into my legs. It's really warm, really hot feeling. Kind of almost feels like you have to go to the bathroom, but you're not. as it was rushing through me, she left the room and suddenly I started going into the scanner. I had to hold my breath for an extended period of time. Felt like a minute. It was probably only 30 seconds. And then I got pulled back out and I was done. I stayed till about the 5-minute mark from the time the contrast came in, just to make sure that I wasn't going to have an allergic reaction. I immediately felt like I had to go to the bathroom again, even though I had just emptied it like 10, 15 minutes prior. And that is because your body does a good job of figuring out that this has no nutrients in it, and the kidneys excrete it right away down into the bladder. So the contrast came out pretty quickly. I'm sure I probably ended up peeing out a little bit more later in the day too, because within another hour I felt like I had to go again. So it actually wasn't too bad. It was a really short procedure, really short scan. And now my doctor can check all the vascularity, make sure that because I've had prior surgeries that no vessels have been cut, and what he thinks he's going into based on just a typical body anatomy is what I really have, since I have had so many surgeries down there. And he's also checking out the vascularity in my thighs as well, just in case we have to have a backup place to go to for tissue. That is another area that they can get donor tissue from to make the breast. And it will also give him landmarks so that when he does the surgery, he knows where those certain vessels are lying and where he is going to need to cut in to get the tissue and the vessels that he needs. So I've had one appointment with my one appointment with the microsurgeons, and it went really well. And this was just kind of the first step in the process to getting set for my surgery. My surgery is scheduled for next month, so I'm excited about that. I found a really good team in the Phoenix metro area that specializes in this procedure and are microsurgeons, which is really important. If you're considering getting this, you need to go to people that do this day in and day out, that have lots of experience. This particular group has 2 microsurgeons on their team that operate at, well, there's 3 total, 2 operate with a PA for any given surgery. And the surgery length is, for me, is estimated to be about 6 to 8 hours. So we will see. And that is inclusive of explants, my implants coming out. I'm getting the capsules out as well around the implants. And then they will proceed to take my donor tissue from my abdomen and move it up. So that's a small little update with me and what's going on. I'm the kind of person that loves to research and loves to know what's going on before a procedure, because the more information I have, the less nervous I am. And so I scour the internet for YouTube videos and Facebook groups and websites, medical websites as well. I do like to see, though, in person, and I do like to just hear firsthand from patients. So that's why I made this video, because there might be somebody else who's wondering the same thing and about a CT scan that they might have to have before a procedure. Now, granted, the one I had, it's the protocol that my surgeons use. The one you get, if you do end up getting one, may be a little different. They might have slightly different protocols, but at least you know a little bit about what to expect if you're going in for a CTA scan before your Diep Flap surgery. I hope to be making another video soon and explaining a little bit more about what's going on. Take care.